Hello everyone, I'm Dr. Sunaina Pamnani, a pediatric and preventive dentist practicing at Smile Isle Dental Care, North Bangalore, Karnataka. Toothache can arise from various factors such as food debris getting stuck in between the two teeth or any foreign object getting stuck between the teeth or under the gum line. Pain can arise from a broken tooth, from a dental cavity, or from the teeth which are erupting. During the eruption, basically the tooth cuts through the gums and it comes out, which can lead to severe pain, and it can be a radiating kind of a pain also. If your child's pain lasts longer than a day and it is not subsiding after using over-the-counter medications, please seek help from your pediatric dentist. While cavities are a common culprit for toothache, but a toothache can also arise from other conditions such as gum diseases or sinus infections or abscesses leading to swelling in the face. Also, simply a toothache can arise when a new tooth is erupting in the jaw. While it is generally safe to give over-the-counter pain reliever medications when the child is suffering from a toothache, it is always better to get a prescription. Because whatever said and done, even if your child was not allergic to any particular medications in the past, he or she can develop an allergy to the same medicine later in life. To recognize issues that can become severe and can cause potential complications, you can look for these signs, like a relentless or a throbbing toothache, a swelling in your child's face or gums, or a broken tooth. These are the conditions where you need to seek professional care immediately. While a broken tooth can cause pain, we don't want the fragments of the broken tooth or any kind of particle getting stuck in your child's mouth, say suppose under the gum, or we don't want the child to swallow that. So in case that happens, you need to seek professional care immediately. Pulling out a baby tooth is not the right treatment, and it's not the first line of treatment that we often follow. Because whatever said and done, the baby tooth is the best space maintainer. So space maintainer, basically your baby teeth has certain functions. It is not only needed for chewing and biting purposes, but it also acts like a guide to allow your permanent tooth to erupt in a particular position, which helps in the final alignment of your adult teeth. Third, it also helps in speech development. So from our end, we try to save the baby tooth as much as possible and allow them to exfoliate naturally. But in certain conditions where we cannot save the baby tooth, there are certain other treatments such as space maintainers which help us hold the space in the jaw for your adult tooth to come and align well.